What is going on, guys? Today we're going to talk about amiodarone. We're going to do a very brief overview, a very high-level overview, because this is something that you may not give a ton unless you're working in an ICU or you're working with patients or perhaps during ACLS, but we do need to understand just the very basics of it. So amiodarone, its trade name is Cordarone, okay? The indication for it is for cardiac arrhythmias, okay? It can be used for atrial and ventricular arrhythmias. A lot of times what you'll see it given for is for a-fib, and then you may also see it given during ACLS for v-fib or v-tach, and can be given as a single dose for v-fib or v-tach. All right, so what do we need to know about this? What we need to know about it is Therapeutic Class is Antiarrhythmic Class 3. Okay, so potassium channel blocker. And what it's going to do is it's going to actually work during the third phase of the cardiac cycle. Okay, so by doing this, what it's going to do is it's going to prolong action potential. It's going to prolong phase 3, and it's going to make the heart, by doing this, by prolonging action potential, it's going to actually make the heart more resistant to arrhythmias. Okay, so basically what that means is going to help the heart and prevent the heart from experiencing these arrhythmias by prolonging that action potential. Okay, it also inhibits adrenergic stimulation, slows the rate, decreases peripheral vascular resistance, and causes vasodilation. Okay, so now that we understand kind of what it does, and again, so just remember what it's really going to do is it's going to be used as an antiarrhythmic, okay? A lot of times for a-fib and then for ventricular arrhythmias, and especially during ACLS protocol for v-fib, v-tach. Okay, so some of the things we need to keep in mind here. One thing we need to keep in mind is it can increase risk for QT prolongation. Okay, so if we're increasing the action potential, there is a risk that we can lead to QT prolongation. We need to monitor our EKG continuously while the patient is on therapy. Okay, we need to be monitoring, is the patient coming out of their arrhythmia? Is the a-fib controlled? Did we correct the v-fib or the v-tach? We need to also monitor and check doses with the second nurse, okay? Before we start a drip of amiodarone or before we give a IV push during ACLS, we really need to monitor and make sure we're giving the right dose, okay? That we don't give too much or that we're not giving enough. Some other things you really want to keep in mind is that it can actually lead to ARDS, pulmonary toxicity, CHF, bradycardia, and hypotension. Remember, we're causing this vasodilation, we're slowing the rate, and so we can lead to bradycardia, and then we can lead to vasodilation. Okay, so if you are sending a patient home and they're taking a dose of amiodarone at home, one thing you need to teach them is you need to teach them to monitor their pulse and report any abnormalities, okay? We need to make sure they understand why they're taking this amiodarone, what the purpose of it is, and then to report anything out of normal with it. So those are really the biggest things you need to keep in mind. Again, this is a very high-level overview. If you want to learn more about amiodarone, I'd really suggest getting on ACLS protocol, and a very good book that talks about it a lot is ICU book by Dr. Marino. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.